Experts speak on the effect of childhood trauma on lifelong wellness. For Psychology 496. Brief overview: the effect of childhood trauma on lifelong wellness. How a child starts their life and how healthy that life is begins to shape who they will be as an adult long before adulthood. This can either do a lot of damage or help the person, making them either have more challenges and possibly mental illness in their adult life, or be all that they can as a well-rounded functional adult. The topic is how various kinds of childhood trauma, such as emotional and mental abuse, can affect the child into their adult years. This is important as we are having more and more adults in the world that suffer from mental illness, and more children that are developing mental illness earlier in their lives. This creates problems for everyday functioning and making the most out of what each individual wants for their life. For a long time, many people have questioned whether or not child abuse leads to adults that do not function well in society, and that may, in turn, abuse their children. Some think that child abuse, no matter its form, can be overcome and not affect the victim at all, while others think that what occurs when someone is a child affects their whole life and can only be adapted around, but never really goes away completely as a problem. Do children that were subject to mental and emotional abuse fare as well in their home lives and careers as those that were not subject to abuse? Do mental and emotional abuse make a child more susceptible to mental illness during childhood and adulthood? These are our two experts. Our first expert is Dr. Craig Connors, who has a dual master's degree from Pennsylvania State University in psychology and social work, a doctorate in psychology from Brigham Young University, Utah, and has been a social worker for 15 years. Dr. Connors has been working in Utah for 15 years, assisting families and children in various unhealthy situations to get safer and healthier environments. Most of his work has been with children that have dealt with trauma in their homes and schools. Our other expert is Dr. Lise Whitaker, who has a doctorate in child psychology from Arizona State University. She also has been a clinical child psychologist for 15 years. Dr. Whitaker has been working in New Mexico for 15 years with children that have undergone various kinds of abuse. Her work has been mostly to help these children learn to express what happened to them, their feelings, and teach them coping mechanisms to minimize the damage done by abuse. Our first expert, Craig Connors, weighs in on our subject. Many child abuse cases that are seen are from families that dysfunction to begin with. This makes abuse the next step in a situation that is already difficult for children to deal with. There are significant associations between childhood trauma and various physical and mental disorders later in life. This can lead to at least a hostile personality, which then can lead to serious social and familiar dysfunctional behavior, which can be attributed to childhood trauma experience. More research is needed in the area of identifying the initial problems with children and their environment to help prevent the cycle from occurring and preventing various physical and mental disorders from developing later in life. Our second expert, Dr. Lise Whitaker, also weighs in on our subject. Many children that suffer long-term abuse do not even know that they are being abused. Evidence of abuse isn't always as easy to spot when it is not physical abuse. Maltreatment of children is more than just physical abuse. Child maltreatment is defined as any act or series of acts of commission or omission by a parent or other caregiver that results in harm, potential for harm, or threat of harm up to a child. It includes all types of physical abuse, sexual abuse, and psychological abuse, as well as physical neglect, emotional neglect, medical dental neglect, educational neglect, inadequate supervision, and exposure to violent environments. This can lead to health-related quality of life problems later in life, making even daily interaction and relationships difficult for adult survivors of maltreatment, since there is a robust, consistent evidence that an inverse relationship between child maltreatment and current HRQOL in both maltreated children and adult survivors of child maltreatment. Earlier detection is needed to prevent the negative effects of such maltreatment. Both of our experts have differing views, but have at least one view in common. Much of abuse starts in dysfunctional families, and there is significant evidence that child abuse causes physical and mental problems in adulthood, is how Craig Connors views the issue. Dr. Lise Whitaker, on the other hand, sees that many children that are being abused don't know that they are being abused, as the abuse isn't easy to spot, and that there is more to abuse than just physical abuse. Emotional and mental abuse, as well as neglect, are just as damaging. Both experts agree that earlier detection could help to prevent the damage that abuse causes later in life.